Welcome to VitalLink Academy in Korea. My topic today is the role, structure, and function of OPO in diseased organ transplantation. I'm In Sung Moon and president of KODA. Welcome all of you here in Korea. What is your job? You and my job are lifesavers. What is the best way to manage organ dysfunction? As you might know, allograft is the number one so far. Recently, xenotransplantation, using gene-modified pig has been reported to some clinical result for short-time follow-up. In your country, do you have DCD or uterine transplantation or face transplantation, such as composite tissue graft? Did you have that one? In the near future, we have to do it. When you look at the current status of organ transplantation in the whole world in last year of 2021, 144,000 organs transplantations were reported in the whole world. Living donor transplantation in 100,000 cases, and deceased donor transplantation in about 40,000 cases. Among the deceased donor transplantation, brain death transplantation is 30,000 cases, and DCD transplantation, donor after circulatory death transplantation, in less than 10,000 cases reported 2 years ago. This organ transplantation is less than 10% of estimated need for organ transplantation in the whole world. This means elephant recipient and small rat donors. Just like No Woman applied by Bob Marley, no donor, no transplantation. Everybody knows well about Kodak film. Remove one last K here. It's gonna be KODA, Korean Organ Donation Agency. KODA is a governmental operated agency dealing with everything all about the brain death organ donation in Korea. For the successful organ transplantation, many factors should be sound and perfect, and collaboration with each other is essential. Any one factor fail, the transplantation will be failed absolutely. The deceased donor organs were property of Korean peoples, not for the individual one. So every organ from deceased donor should be allocated with fair, equal, and clearly to the appropriate recipient. We had 3 governmental operated institutes, such like a KODA, is a Korean Organ Donation Agency, and KONOS, Korean Network of Organ Sharing, and Ministry of Health and Welfare. Our KODA job is all about deceased donor transplantation, as you might see here, with heavy burden of DIP in my back. DIP means Donor Improvement Program. In KODA, we have 70 registered nurses, 10 social workers, and 10 laboratory technicians, and 30 administrative officers, and 2 medical doctors. This is me, and this is Dr. Park, who are in charge of immunology lab for transplantation. The very first governmental organization for organ transplantation is KONOS, just like a Koran network for organ sharing, started in year of 2000. And 20 years later, its name is changed to National Institute of Organ, Tissue, and Blood Management. We have a couple of transplantation-related institutes in Korea, just like KONOS, so National Institute of Organ, Tissue, Blood Management, and KODA. And we have 110 transplantation hospitals. And we have donor card registration in 400 or maybe more institutes. And we have 36 hospital-based organ procure organization and 99 brain death diagnosis hospitals. KONOS had very important roles in organ transplantation. Number one, organ and tissue donor registration and management. And number two, select proper recipient by national base. It should be clear, fair, and equal. And set the standard in organ harvest and organ transplantation, and produce statistics and control of all transplantation hospitals, KODA, and tissue bank. Basic principle for living donor transplantation is donor safety, no harm to donor. And principle of transplantation for brain death donor, number one is dead donor rule. Organ should be recovered from the dead status. And all the brain death organs is property of Korean people. So strict control recipient selection is number one priority, and same ABO blood group or compatible group, and 6 antigen matching, number one priority for national base one. The role of independent OPO KODA is referral center and arrange and assist the whole brain death donation process from start to the end, donation consent, brain death diagnosis, organ recovery, tissue bank refer, and also immunologic study, KODA lab. And another one is donor transport to brain death managed hospital and communication between donor and recipient hospitals, donor care during and after organ recovery, and immediate post-mortem donor family care and long-term family care. In Korea, the very first kidney transplantation was performed in 1969 by Catholic University Medical Center by my big boss, Professor Y.K. Lee, at the time living related donor from patient mother to son. For the liver transplantation, first liver transplantation was performed in the year of 1979 by Professor Kim Soo-tae at Seoul Yatsenan University. Some kidney and livers were performed since then for over 20 years by the individual hospital base, by the so-called big hospitals in Korea. When Korean Society of Organ Transplantation released the Seoul Declaration concerning about the brain death for the first time in Korea in late 1980s, the brain death law was started for inactivated from the public. In the year of 2000, law about the transplantation was enlisted finally. Then the KONOS was founded in the Ministry of Health to regulate everything about transplantation. Connors law is very important as a governmental regulator. All the living donor recipient relations were examined, and every transplantation should have permission from Connors, living and also deceased donor altogether. Transplantation before transplantation law since 1969 to year of 2000, so-called big hospitals, Catholic University, Severance Hospital, Seoul National University, Asan, Samsung University Hospital, all were done by own hospital base. This is one of the top secret of our Korean situation. It's a confidential. We had mandatory report of potential brain death donor patient in the year of 2011, 10 years after the law about the organ transplantation inactivated. It is one of the important revision of the transplantation law. Since that time, the revised the national transplant law, the number will be somewhat increased in the number from 400 to 500. But when we, as you see here, during the corona attack, there's somewhat decrease in the number. The organ donation process proceed in the following order. The consent of the family and brain death determination and recovery and family care program. CODA support and take charge in this process. For the tissue donation, we transfer donor to the tissue bank after obtaining family consent. The tissue bank performs tissue collecting, storage, and distribution. In detail, after receiving information from hospital ICU, we visit there and double check out the medical condition and blood sampling to the CODA lab for immunology study and brain death diagnosis assist, and then recovery, and then allocation by the Connors will be followed, and transplantation in the each recipient hospital. And then we have to do some family care program by our social workers. If tissue donation consent, we refer to the Korean Public Tissue Bank, and they do everything about the tissue. In detail, we had referral center in CODA by phone or electrical referral system and message on the cellular phone. Then we hurry to hospital with my speedy car. Sometimes we have checked by the police. And then we double check up the patient condition. During COVID, about 20 to 30 times rapid nasal swabs were done for almost every hour CODA coordinator in a year. After arriving at the hospital, our CODA coordinator evaluates donor status and suitability by checking respiration status and pain response and cranial nerve reflexes. Intensive specialist, neurosurgeon, and neurologic doctor had difficult situation at the time, considering the organ donation. At that time, don't say organ donation directly to the patient family members, but just talk to the family I had to report to CODA about patient condition by the law, and I will arrange meeting with CODA nurses. That's all we CODA want to you as a first step. Once again, just talk to the family members about patient medical condition only. Let organ donation matters to the CODA coordinators. If there are no medical contraindication to organ donation, our coordinator conduct interview with family for donation, providing information about donation and supporting family. All the organ donation process should be explained carefully. This job is one of the main jobs for CODA coordinator. As soon as obtain consent from family member, brain death determination procedure started. At the same time, donor blood samples were collected for immunologic study and sent to CODA lab for HLA typing, PRA, and HLA cross-matching test. In CODA lab, we had deep refrigerator. We had 40,000 patient sera in the waiting list. For the HLA cross-matching test between donor cell and over 20 recipient candidate sera, CODA lab tried to finish within 5 hours. All the data were shared to Kronos by KNet system, and the Kronos can arrange every organ allocation. What you can see in this slide is a red side is an emergent one. All the tests will be on the emergent base, especially for heart, lung, and liver. The brain death diagnosis procedure consists of 4 main steps. First step, specialist conduct examination for brainstem reflexes and apnea test. And second, the same method as the primary test with a time interval between first and second examination according to donor's age. Insert, identify the flat EEG for over 30 minutes, and last step is the brain death determination committee. It's very unique in Korea. Although brain death was confirmed at the hospital base before the year of 2000, when the brain death transplantation law was inactivated in Korea. So from that time, before the year of 2000, each hospital-based brain death confirmation committee had a critical role for brain death confirmation. You can find non-medical persons such as Catholic father, monk, and nun, and or attorney were one of the members of that committee. When comparing to other countries, we Korean had a somewhat strict criteria for brain death confirmation, as you see here. This is the sample of KNet. Only authorized person can approach this KNet. Even for me, I'm not authorized to be a user. All organ recipient selection is possible with this KNet information by Kronos. This is the general recipient selection guideline. Number 1, same ABO blood group. And number 2, family priority. And number 3, kidney priority. It's a unique in Korea too. And number 4, same reason, the regional priority. Then finally, organ recovery was performed by each recovery team from recipient hospital. You can find many shoes of each organ recovery team from many recipient hospitals in the donor surgery operation room. Before starting organ recovery, the operator, who usually a senior surgeon, say, keep in silence for a couple of minutes or a couple of seconds for the respectation of donor. At the same time, in hospital broadcast during the organ donor recovery, such like in this our hospital.
안녕하세요.
Now,
신장을 이식받고
we are
제2의 삶을 살고
donor
있는
surgery was
KBS 오수진
performed in
기상캐스터입니다.
the one
지금
room
우리
of the
병원에는
operation.
생명 나눔으로 누군가에게 삶의
Would
기적을
you please
선물하고
keep
하늘 여행을
silence
떠날
a
준비를
couple
하고
of
계신 분이
seconds?
계십니다.
And
다른
we
이에게
will
생명이라는
remember
귀한 선물을
the
주고
donor
떠나시는 기증자와 그 가족을 위해 잠시 하던 일을 멈추시고
all organs were recovered and hurry back to recipient hospital. Hurry back to recipient hospital. What you can see here in this slide is a post-mortem care by our CODA coordinators and social workers. Surgical wound repair by 2 organ procure coordinators, and remove all blood and other dirty fluid from body surface. Apply clean dressing and hand over the body to the family members at the morgue room with respectation. Coordinators do the best for donor post-mortem care. After donation, coordinator have funeral process, support the family, and hand over donor family to social workers. Sometimes we, actually social workers of CODA, prepare graveyard for the family. Here you can find letter of life sharing certification from the Secretary of Ministry of Health in Korea with flowers. After all procedure of one brain death donor organ transplantation recovery, my CODA coordinator need a short time nap on the way back home, especially in the midnight or 3 a.m. in the dark night. And also you can find bright light on the 8th floor of CODA lab in the same dark night. Tonight, CODA saved at least 3 lives. And this is current status of Korea. Last year, we had more than 40,000 patients in the waiting list, and only 405 brain death donors, and only 167 tissue donors last year. This is our situation now. So last year, almost 8 patients passed away during waiting for organ transplantation. Looking for the slide here, next transplantation bus will be 5 years later for kidney and pancreas. And so many patients are exhausted during waiting for the next bus. And also, we had more than 2,000 presumed brain deaths reported, but true brain death donor is 400. That means consent from the family is very limited, less than 40%. So last year in Korea, we had 2,000 kidney transplantations and 1,400 liver transplantations. Among the 2,000 kidney transplantations, more than 65% is living donor. And when you look at the liver transplantation, more than 75% is a living donor partial liver transplantation. Also, you can see here heart transplantation 167, lung 136, pancreas 31, small bowel, all were done by the brain death donor. When you look at the recent 10 years, you can see here for living donor transplantation, incompatible ABO blood group transplantation is increased rapidly. And for the cadaveric donor or brain death donor, heart and lung transplantation is slowly increasing the number. You can find 1,300 happy recipients from 400 brain death donor last year of 2022. This bell sound is sound of hope, new life. The patient on the waiting list want to hear. With one more donor, the bell sound will be more and more louder. KODA, Korean Organ Donation Agency, always with you, my friends. That's all, and thank you for your attention.